We asked Dr. Glick how he makes Jericho Road work when the rest of the medical system excludes so many people for financial reasons. His solutions are simple. They have electronic medical records. They're efficient with billing. They schedule patients so there's no waiting around. And most importantly, they hire staff who care deeply for the patients. In fact, the entire business model at Jericho Road is not based on making profit, but based on ideals. Running a business this way, Jericho Road is now doing better than ever. As the practice grew, Jericho Road couldn't take all the people who wanted to be their patients. So the practice made a surprising decision on who they would take.
A couple years ago, the need was overwhelming. We were getting, so many calls for patients to come in here and be our patients. And so we decided that we would only accept new patients who have no insurance, new patients who are refugees, or new patients who are pregnant. And that's counterintuitive to how you would run it from a business standpoint, right? And the irony is, we made that decision, and the last 2 or 3 years have been the most profitable for us.
When you walk into Jericho Road Family Practice, you might be surprised by what you see. The people that work there, whether it's the people answering the phones or the nurses and the doctors, they don't appear to be counting down the minutes to lunch or the weekend. They seem happy.
Our doctors don't make the going rate, and our staff sacrifice to be here. Although, they get paid good, but it's not the going rate. We don't have a lot of people sitting around managing. We can't afford to just have someone sitting in an office. We're primarily working and doing.
Jericho Road takes all insurance plans and expects that even uninsured patients will pay something based on their income. If you have insurance, you're probably used to having an appointment time. But many patients with Medicaid or without any insurance have to wait hours to see a doctor.
We decided we're going to give everyone an appointment time, and we're not going to double book those appointment times, and we're going to assume that people are going to show up. Because the assumption was, the poor aren't going to show up. Well, yeah, if they have to wait 4 hours, they're not going to keep the appointment unless they're really, really sick. But what if you treat them well and you show them respect? Will they come back? I don't sit around ever waiting for a patient to come in. They come. I'm not sure that we've been able to affect change in the greater medical system in Buffalo. It seems like once a month I get this notice from a doctor saying, we're moving out to some destination in the suburbs. Someone looks at the sheet and says, why do we have this place open? We're losing money. They just close it. And it's frustrating. We now have 2 big hospital systems. Their primary aim seems to be competing for cardiac surgery, for kidney transplants, for high-end chemotherapy, and very little competition at all for people in the community who need doctors. I think the biggest problem is people's fear of not being able to make it financially, and their unwillingness to sacrifice to make it happen. I don't really understand it when we're able to make it work, and it's frustrating.